All right, let's decode a bone marrow report. We're going to crack this thing together.
Yeah, these reports look super complex, but they're packed with clues about a person's health.
We're going to use a simple 4-clue checklist. Think of it like a detective's guide to the report.
First up, clue #1, cellularity. We're checking the scene. Is it too crowded, too empty, or just right? So a good rule of thumb is 100 minus the patient's age. Anything else points to certain conditions.
Okay, clue #2 is the ME ratio. Think of it like comparing guards to factory workers. Normally, you're looking for a 3-to-1 ratio. That's 3 myeloid for every 1 erythroid cell. If that ratio is off, that's a huge clue. It points us toward totally different kinds of problems. Now for clue #3, the blast percentage. This is probably the most critical number in the whole report. Normally, blasts, those are the baby cells, should be less than 5% of the total.
But if that number hits 20% or more, that's a diagnosis of acute leukemia.
And our last clue, iron stores. It's like checking the supply room. Does the body have its raw materials? If the iron stores are gone, poof, absent, that confirms iron deficiency anemia, a clear motive. Okay, case closed. Let's put these 4 clues together and see the full picture, the diagnosis. And there you have it, our 4-clue checklist. Cellularity, the M/E ratio, blast count, and iron stores. So now you've cracked the code. With this framework, you can grasp the basics of any bone marrow report.